editor. ഇപ്പോൾ ലൈവ് പോയിക്കൊണ്ടിരിക്കുകയായിരുന്നു. ഓക്കെ, എനിക്ക് ഞാനവിടെ ഇൻട്രോ കൊടുക്കണം.
Hello students, welcome back to Easy Nurse, where nursing education made easy. So today we are going to dive into the unit 2 of maternal nursing in our PBBSC, right? So let's start about today's live session. So mainly in this live session I am going to discuss regarding the female reproductive system and as well as the female pelvis, which is an assisted female reproductive system, right? So let's start about today's topics. So first is the reproductive system. So what do you mean by the reproductive system for the female? So reproductive system for the female are those which connected with the population, fertilization, growth and development of the fetus, as well as it's going to subsequently exit to the outer world. So this all process is belongs under the reproductive system of the female body. So what are the things? Population means giving birth, then fertilization, growth and development of the fetus after implementations of the zygote inside of the uterine endometrium layer, and after till the delivery of the viable product of conception. So these all are the components, or these all are the things that are happening which is belongs under the reproductive system. So this female reproductive organs, it's subdivided into the three parts. So what are the three parts? First is external genitalia, second one is internal genitalia, and last one is accessory reproductive organs. Accessory reproductive organs in the sense like they are not directly connected with the reproduction system, but as a passively they are going to connect it by producing some hormones or other factors. Okay, so let's start about the external genitalia. So external genitalia is nothing but from outside what and all reproductive organs or things we can see from the in the female body. So that is called external genitalia. So external genitalia is also known as a vulva. Okay, so all of the parts of external genitalia all togetherly it's known as vulva. So vulva is a composite name of the external genitalia. So what are the things as there means including in the external genitalia? First is the mons pubis. Second one is the labia majora. Third one is the labia minora. Fourth one is the clitoris. Then vestibule. Then under this vestibule there are three types of opening. First is the urethral opening. Second one is the vaginal opening. Third one is the fourchette. Then Bartholin ducts opening. So these all are the four openings that are under the vestibule as well as the perineum. So these are all under external genitalia. So one by one today we'll discuss. First is the mons pubis. What do you mean by the mons pubis? So what do you mean by the mons pubis? Mons pubis is nothing but it's a triangular shape. Okay, and it's amount of the fatty tissue which covers the pubic bone area, as well as with this fatty tissue covering, it's going to protect the symphysis pubis. So during the adolescent sex hormone, when it's triggered the growth of the pubic hair on the mons pubis, and the hair is going to vary from one individual to another individual through some characteristics. As example, coarseness, curliness, amount, color and thickness. Okay, so these all are about mons pubis. So mons pubis is nothing but it's a triangular shape, and then fatty tissue is going to cover only that portion. It's going to cover the pubic bone region, as well as it's also help to protect the symphysis pubis. Now come to the labia majora. So labia majora is nothing but it protects the introitus and then urethral opening. So this labia majora is also covered with the hair as well as the sebaceous gland of this area, and it's very smooth, flaccid, moist and hairless. So day by day when they are going for the childbirth and all, so day by day it's becoming so flaccid with along with the age also. Okay, so these all are about brief description regarding labia majora. So now come to the labia minora. So labia minora is nothing but it's going to referred as the inner lip of the external genitalia. So you just remind, labia minora is also known as the inner lip of the external reproductive system. Same as like you have to remember here also that mons pubis is a triangular shape. So labia majora is nothing but it's only as like protecting the introitus and urethral, but labia minora is a inner lip. Okay, so it's made of a erectile connective tissue which darks and swells during the intercourse. So while they are going for the sexual intercourse, that time the connective tissue of that particular area is become so erected. Okay, and it's also becoming as a like color change formation. You can see like darkness means the pigmentation level is going to be changed. So it's located inside of the labia majora and labia minora, which tightens during the intercourse time. So these about the brief description regarding the labia minora. Now come to the next, that is clitoris. Clitoris is nothing but it's a highly sensitive organ which is composed of a nerve, blood vessels and then erectile issues. Okay, so it's made up of the shaft as well as the glands. Okay, so it becomes very engorged during the blood with blood during the sexual intercourse. So that's why through this clitoris the sexual triggerness will be coming in the female body, and urethral opening which is located directly below of the clitoris. Okay, so these all are about brief description of the clitoris. Next one is the labia majora. So labia So next one is the vestibule. It's not labia majora, that is vestibule. Okay, so vestibule is nothing but that is also one of the like triangle space which is bounded anteriorly by the clitoris and posteriorly by the fourchette and either side by the labia minora. So what is the kind of surroundings? First, anteriorly it should be clitoris, posteriorly should be fourchette, and side by side it should be in a labia minora. So there are four openings. What are first is the urethral opening. So it is situated in the midline just in front of the vaginal orifice. Next one is the vaginal orifice which lies in the posterior end of the vestibule, and hymen you can see in this part. It is a thin fold of the mucous membrane which is close the circumstances of the vaginal orifice. So during the sexual intercourse it's going to be farting. Next one is the Bartholin's ducts. It lies posteriorly to the vestibular bulb, and fourchette is nothing but it's a thin fold whole skin which is formed by the fusion of the labia minora. So these all are about vestibule. And last one is the perineum. Perineum is nothing but it's a muscular area between the vaginal introitus and then anus. Okay, so what is the composition? Connective tissue, muscle and fat. Okay, so these all are about external genitalian organ. Now come to the internal genitalia. So internal reproductive organs of the females which is lie in a pelvic cavity which require the special instrument for during the inspection time. Okay, so it's consisting of one vagina, one uterus, two uterine tube or the fallopian tube and two ovaries. So these all are under internal genitalia, because while you are going for vaginal examination or uterine examination, fallopian tube examination as well as the ovaries examination, you have to go for the special instrument. As example, for the vagina, you have to go for the vaginal speculum for the vaginal examination. Okay, so which helps to be like whitening of the anterior as well as posterior wall of the vagina to proper examining inside of the vaginal circumstances. So same as like for uterus also you have to use some other instruments. So these all under like internal genitalia. So first is the vagina. So vagina is nothing but it's a muscular tube, okay, which is extends upward as well as a backward from the vulva to the uterus. Next one is which is measures 3 inches long and the upper end of the vagina which is perceived by the cervix. Next one is the area of the vaginal lumen which is surrounds the cervix, and it's going to divide it 4 region: anterior region, posterior region, right and left lateral region. So now come to the uterus. So uterus is nothing but it's a hollow and pear-shaped organ with a thick muscular walls. So that's why it's called as a uterus. It's a like hollow shape organ. After this implantation, no, it's becoming as a pear-shaped structure. So day by day, the shape of the uterus is going to be changed because it's a hollow. Next one is its measures is 3 centimeter in long and 5 centimeter in wide and 2.5 centimeter in thickness. So when after conceiving the pregnancy, what is happened, length as well as the wideness is going to be elongation, but thickness is going to be reduced because the muscular layer of the like thickness is going to be deducted. Next is the parts. So it's divided into the 3 parts: fundus, body and cervix. Fundus is nothing but like upper part of the uterus, and body which is lies below the entrance of the fallopian tube, and cervix which is narrow part of the uterus. So these are on the 3 parts of the uterus: fundus, body and cervix. Next one is the function. So what is the function? First is the menstruation. That is also happening in the endometrium layer. So during the menstruation, what is happening? The blood which is like unwanted or unnecessary blood, actually the bad blood kind of things, it's coming through the breaking of the endometrium layer. Next is the pregnancy, then labor as well as the involution. So labor is nothing but like from the ostial region of the uterus, the labor pain is going to be started. So that's why this labor pain is also one of the functions of the uterus for delivering the baby. Next one is the fallopian tube. So fallopian tubes is nothing but it's a through muscular tube which is about 10 centimeter long. So it's extend from the uterine cornu. So uterine cornu to the outwards, and laterally they are going towards to the ovaries. Okay. Next parts. What are the parts? This part is called isthmus. Next one is the infundibulum. Next one is the ampulla, and next one is the fimbriae. Okay. So this finger-like structure is known as a fimbriae. So these all are the parts, and this the ampulla part is one of the main region where fertilization will take place, as well as after ovulation the mature ovum is coming and they are staying inside of the ampulla only. Okay, so next one is the function. So what is the functions? Transport the ovum from ovary to uterine cavity, then they receive the spermatozoa for the fertilization. How? Through the cornupods. And next is supplies the nutrition to the fertilized ovum. How through the fimbriae. Okay, so these are all the functions. Now come to the ovaries. So ovaries is one of the paired sex gland obviously, and it's a almond shaped structure which is situated on each side of the uterus. So both sides one ovaries are present. So total 2 ovaries are present inside of the female body. So what is the measurement? 4 centimeter long, 3 centimeter wide 2 centimeter thick in size and weight is around 5 to 10 grams. So during this like visual examinations or the through the ultrasonography, if you can see like nodules type of the structure surrounding of the posterior wall of the ovaries, so it means there is a cyst formation. Okay, next one is the structure. So what is the structure? Outer part is called cortex, middle part is called medulla, and the inner side part is called hilum. Okay, so what is the function? So during the reproductive period, the ovaries, they are going to discharge the mature ovum at each menstrual cycle. So after completion of the each menstruation cycle, within 14 days they are giving this the mature ovum from the ovary, and through the fimbriae it's come to the ampulla part. So during that time, if the person gone for the unprotected sex, there is a chance for the highly pregnancy. Okay, so it produce the sex hormone estrogen and then progesterone. So mainly what is happen at the first stage of the pregnancy, the ovaries are only producing estrogen and progesterone for balancing the hormonal level in the circulation system. But after formation of the placenta, what is happened? This role is going to exchange to the placenta. So that time the ovaries, they don't have any work. So that placenta is started to produce estrogen and progesterone to amplifying the pregnancy. So these are all the functions of the ovaries. So now come to the accessory reproductive organs. Accessory reproductive organs is nothing but these organs, they are not actively elaborating the pregnancy journey or the labor journey, but passively it's going to connected with the labor journey. Okay, so first is the breast. Breast is nothing but it's a paired mammary gland which is present or situated between second and sixth rib cage. Okay, so next structure. So from the anterior to posterior, you see the structure. First is the thoracic wall, second one is the pectoralis major, next one is the lobules, then lactiferous ducts and fatty or adipose tissue. So lobules is nothing but which from where the milk secretion is coming, and then lactiferous ducts is nothing but in that duct this milk is coming and engaging. So when the baby is gone for the sucking, so it's creating a signal into the posterior pituitary as well as anterior pituitary. So from there they're releasing the hormone, and during that time from the lobules the milk is coming to the baby's mouth. Okay, so these and all the functions of the lobules and lactiferous ducts. And last one is the fatty or adipose tissue. So these and all the structure of the breast. Next there is a paired mammary glands between second and sixth ribs. Okay, so now come to the accessory reproductive organ. Second one, that is female pelvis. And this is one of the most important topic for your exam. For the fiber questions of 5 marks or 10 marks, they will ask you explain the female pelvis. Okay, so that is one of the most important topic. So first, female pelvis is nothing but it's a bony basin shaped structure. Okay, it's a only bony structure, no other muscles, nothing is there. So it's a bony and then ligamentous pelvic mechanism which is designed to protect the pelvic viscera, support the vertebral column. So while sitting and then standing, no, so they are the female pelvis is one of the things which is mainly supporting the vertebral column and then balancing the weight. Okay, next pelvic girdle which protect the viscera which is contained within its cavity, and it's help for the seating for the woman, not only sitting, standing also. Okay, so now come to the bones. So in the female pelvis there are mainly composed of 4 bones. First is innominate or hip bone, 2, then 1 sacrum bone and 1 coccyx bone. So total 4 bones, 2 hip bone, 1 sacrum and 1 coccyx. Next one is the innominate or hip bone. So innominate or hip bone, there are having 3 parts. Upper part is called ilium, this part is called ischium, and where this the 2 kind of this hip bone is coming and fusing together. So this part is known as a symphysis pubis. So there are mainly 3 types of the subbone. First is ilium, ischium and symphysis pubis. So in this the ilium there are so many parts. First part is called iliac crest, then anterior superior iliac spine, anterior inferior iliac spine, anterior posterior superior iliac spine, posterior inferior iliac spine. Okay, next come to the ischium. So in the ischium, that is ischial tuberosity, acetabulum, Next one is the obturator foramen as well as the ischial spine. Okay, next come to the symphysis pubis. This upper portion of this two bone, no, it's called as a superior rama, and lower portion of this the symphysis pubis is known as a inferior rama. Okay, so these and all the parts of ilium, ischium and symphysis pubis. So for the ilium, iliac crest, anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine, posterior inferior iliac spine. That's it. Now come to the ischium. So in the ischium, ischial tuberosity as well as ischial spine, acetabulum and obturator foramen. Next is symphysis pubis. For the symphysis pubis, only superior rama and inferior rama. One of the things are there, that is ischial spine. So one of the thing is there, that is the sciatic notch. Okay, so sciatic notch is nothing but greater sciatic notch and lesser sciatic notch. Greater sciatic notch, which is extend from the posterior posterior inferior iliac spine to the ischial spine. So that is called greater sciatic notch, and lesser sciatic notch from the ischial spine to the ischial tuberosity. So that is called lesser sciatic notch, and this sciatic notch is present inside of the ilium and then ischium part. Okay, so these and all about the hip bone. Now come to the sacrum. So for the sacrum, it's nothing but it's a wedge shaped structure. It's mainly consists of the 5 fused vertebra bone at a same together. It has mainly the 2 ala wing structure, and then anterior surface of the sacrum is very smooth and concave, and which is referred as a hollow F sacrum, and then posterior sacrum is very rough. Okay, so what is happened, it's mainly helped to receive the attachment of the muscles. So that is called sacrum. Now come to the coccyx. So coccyx is nothing but it's a 4 fused bone and forming a triangular shape. So coccyx bone is also known as a tailbone. Okay, so now come to the types. So what are the types? First is the gynecoid pelvis, means female pelvis type. So first is the gynecoid pelvis, that is the most common type of the pelvis. So its shape as like rounded and wide shape. It's resembling as a oval shape. Okay, so what are the features? This like gynecoid pelvis, it's a main ideal for the childbirth, especially for the normal vaginal delivery, and it's spacious with the well-rounded pelvic walls. So what is the frequency? Around, it's found, you can see, for the 50% of the women. Now come to the android pelvis. So android pelvis shape is nothing but like a heart shaped structure or the triangular, and is resembling as a typical male pelvis. Okay, so what is the features? It's a narrowing pelvic cavity, making the vaginal delivery once more challenging. So if the fetus is having not in a well-being condition, so that time we have to shift for this kind of pelvis mother to the emergency LACS. Then frequency found in about minimum 20% cases. Now come to the anthropoid pelvis. So anthropoid pelvis is nothing but it's a oval, but it's a longer in the anterior posterior direction. So what is the features? It's mainly favors like direct descent of the fetus, which is associated with the easier childbirth, which is compared to the android pelvis. And what is the frequency? Mainly you can found about the 25% cases of the women. Last one is the platypeloid. So platypeloid is nothing but it's a very flat and wide shaped structure which is resembling a kidney bean structure, and it features is nothing but it's a narrow anterior posterior diameter, and vaginal delivery also it might be difficulty. So what is the frequency? You can find for the 5% cases. So for the platypeloid pelvis, only cesarean section is one of the main and best like way to deliver the baby. For the anthropoid, like vice versa, and for the android you can go for the normal vaginal delivery if the baby is having no kind of any kind of the disease or any kind of the complications. But for the gynecoid pelvis, always ready for the normal vaginal delivery. Okay. Now come to the joints of pelvis. So what are the joints of pelvis? Symphysis pubis, sacroiliac joint 2 and sacrococcygeal joint. So symphysis pubis is nothing but this part where two hinominate bone or hip bone is coming and fusing together. Sacroiliac joint is nothing but where sacrum and then ilium is going to join. So this part we know as a sacrum, and this bone, two bone, is called as a iliac bone, right? So this part, So where sacrum and ilium, this part are coming and fusing together, this part is known as a sacroiliac joint. So that's why two sacroiliac joint. And sacrococcygeal joint is nothing but where sacrum and cock is fused together as a posterior part. This is the sacrum 5 fused bone and cock is 4 fused bone. Okay. So now come to the landmarks of the female pelvis. This is also one of the most important topic. So landmarks. First come to the, you can tell the landmarks from anterior to posterior or posterior to anterior. Okay, so now I am telling you from like anterior to posterior. Okay, so first is the symphysis pubis, then pubic crest, symphysis pubis, then pubic crest, pubic tubercle, pectineal line, iliopubic eminence, iliopectineal line, sacroiliac joint, ala wings and sacral promontory. So these are under 10 total 9 landmarks are there in the female pelvis. These are the main. Okay, so what are the things? First is the symphysis pubis. Next one is the pubic crest, is a like wave shape structure, that is pubic crest. Next is the pectineal line. One straight line type of structure is there, that is pectineal line. Then iliopubic eminence, same oval like structure, oval shaped structure is present like Hardy. So that is iliopubic eminence. Same again one the straight line is there, that is iliopectineal line. Next one is the sacroiliac joint where sacrum and that iliac bone or the hip bone join together. So that is called sacroiliac joint. Next is the ala wings and last one is the sacral promontory. So these and all are the total 9 landmarks which all are the most important. Okay, main landmark. Other than that, what and all things are there, that is coccyx bone. Next one is the obturator foramen in the ischial. Next is the ischial spine, ischial tuberosity, acetabulum iliac spine as well as the sciatic notch. I already discussed those things in during while I was discussing about the parts of the hip bone. Okay, so mainly so there are total 9 or 10 landmarks. Okay, now come to the ligaments. So ligaments is nothing but where the joint they are connecting with each other, right? So what and all ligaments? First is the intrapubic ligament in between the symphysis pubis, sacroiliac ligament in between sacrum and then iliac bone. Next one is the sacrococcygeal ligament in inside of the sacrococcygeal joint, sacrotuberous ligament which is present inside of the sacrum sacrum as well as the like tubercle joint. Next one is the sacrospinous ligament from sacrum to the ischial spine. Now come to the parts of pelvis. So pelvic consists of the 3 parts. What are the 3 parts? First is the inlet, cavity and outlet. So inlet is nothing but like upper portion, cavity means the middle portion and outlet means like lower portion. So inlet is covered through the sacral promontory, ala wings, sacroiliac joint, iliopectineal line, pubic tubercles, then pectineal line, pubic eminence, symphysis pubis on both sides. Okay, means complete landmarks they are completing, means they are consisting of a within like 10 landmarks of the female pelvis. So that is called pelvic inlet. Now come to the cavity. Cavity means a hollow shaped structure, means like mid portion. And outlet mainly they are covering as a ischial tuberosity, ischial spine, then coccyx as well as sacrococcygeal joint, sacrum and along with the like obturator foramen, etc. Okay, so these and all the pelvic outlet. So now come to the diameters. This is also one of the most important questions, diameters of the female pelvis. Any kind of like essay questions, short questions as well as the viva questions. So mainly there are the diameters they are measured in the brim. So first we are discussing about the brim. So in the brim, first is we are going to discuss regarding anterior posterior diameter. Okay, so there are mainly 3 types of anterior posterior diameter is present. First is the anatomical conjugate. So anatomical conjugate is nothing but which extends from the midpoint of the sacral promontory to the upper part of the symphysis pubis. So that is called anatomical conjugate and measurement is 12 centimeter. Obstetrical conjugate is nothing but it extends from the upper part of the sacral promontory to the middle part of the symphysis pubis, mean inside. Okay, inside part of the symphysis pubis mid portion. So that is called obstetrical conjugate and that is 11 centimeter. And diagonal conjugate it extends from the upper part of the sacral promontory to the lower tip of the symphysis pubis. So that is called minimum 10 centimeter. Okay, so these and all the diameters of pelvis. Now come to the oblique diameter. Oblique diameter, it extends from one sacroiliac joint to the opposite side of the iliopubic eminence. This diameter is called as a oblique diameter and measurement as a 12 centimeter. And last one is the transverse diameter, which is present in between two iliopectineal line. This portion is iliopectineal line, right? So in between two iliopectineal line, the diameter is present and it measures 13 centimeter, and it is the largest diameter of the brim. Just point to be noted, it is the largest diameter of the brim. Sometimes in the Viva question they will ask you what is the largest diameter of the brim, then you have the answer should goes to the transverse diameter. Okay, now come to the pelvic cavity. So in the pelvic cavity region, it is a 12 centimeter length from each aspect and the depth is 4 centimeter. Okay, no other diameter are present. Now come to the pelvic outlet. So in the pelvic outlet there are two diameters. First is anterior posterior and second one is transverse diameter. So anterior posterior, which is extend from the lower tip of the symphysis pubis, lower tip of the coccyx to the lower part of the symphysis pubis, and its measurement is like 13 centimeter. And transverse diameter, which is present between two ischial tuberosity, and its measures around the 11 centimeters. So this part is called inferior rama, right? So this is the part of the ischium. So this part is called ischial tuberosity. So in between ischial tuberosity the diameter is present, so that is called transverse diameter and measurement is 11 centimeter. Okay, so in this session I discussed about the female reproductive system, internal, external as well as the accessory. I hope you all understood my session. Again we'll meet in next live session. Till that, keep learning and stay tuned with the easy nurse. Thank you.